Ovarian cancer is the leading cause of death of all gynecological cancers. It's an insidious disease that often strikes without warning. Every 10 hours, a woman dies from ovarian cancer in Australia. Currently, no simple or effective early screening method exists, which means most women diagnosed are already in the advanced stages of the disease. The OCRF is committed to developing and implementing an early detection program, improving the mortality rate, the management and long-term survival of women with ovarian cancer, and gaining a fundamental understanding of the causes of ovarian cancer. The corporate and community support the OCRF have received over the last few years has allowed the OCRF to understand the elements of this disease and, most importantly, bring us closer to producing a test that can be evaluated in a large population study. This positions the OCRF as a leading independent agency dedicated to the vital research of this insidious disease. The Ovarian Cancer Research Foundation was co-founded in May 2000 by Associate Professor Thomas Jobling and Chief Executive Officer Liz Heliotis.
We started with an old Frigidaire with a chain around it, which was the repository for our biological specimens, and we've moved through to some state-of-the-art scientific equipment.
If there was one message that you wanted to get out to the community, what would that be?
I think we need to support the research scientists that we have in this country, because I think we are the equal of anywhere in the world, and I think we've got a unique opportunity to develop an early detection test for ovarian cancer.
Dr. Andrew Stevens is the NAB OCRF Research Fellow Group Leader. So Andrew, how has your involvement with OCRF evolved over time?
We've assembled a fantastic team of researchers. They're all very experienced in the different aspects of what we do. We have this great research facility now that the OCRF has put together over the last few years. And the team that we have has really pushed new technologies and new directions in ovarian cancer research.
Currently, ovarian cancer has a lower survival rate than both breast and cervical cancer, both of which have early detection tests. The Ovarian Cancer Research Foundation, OCRF, is working hard to change this and improve the survival rate by developing an early detection test.
I think that we're in probably the best position that we ever have been in to develop an early screening test.
So Adam, you're one of the research scientists here supported by the OCRF. In a typical day, what does your research unit do?
Every day isn't that typical. We come into the lab in the morning, we design our experiments. I mean, you might find a result that's pretty exciting, and you might have to change your experiment based on these results. The trick is trying to find enough proteins that are different in patients that don't have the disease versus the patients that do have the disease.
At present, when detected and treated early, 80 to 100% of women will survive beyond 5 years, compared with only 20 to 30% when diagnosed at a late stage.
Many women today who are caught too late, of course, have a very low survival expectancy. However, with this new test in the future, we know that we will be able to detect earlier and thus save a lot more women.
So Katie, what are some of the challenges that you face in doing this research?
One of the bigger ones that we face is the time that it takes to not only carry out the research that we do, but then once we've done the research, we get large amounts of data back that we've got to analyse and understand and somehow put it all back together.
So advances must be satisfying.
Hugely. Hugely. That's why we keep coming back every day.
So Nicole, you take the lead in the clinical collection program. Can you tell us how this works?
Myself and the research nurses interstate actually attend the operating theatre. We obtain consent from the patient prior to entering the operating theatre. We actually collect and process and store samples. This enables our researchers to have access to the best quality specimens available.
Tanya Brown is an inspiring woman who is currently battling ovarian cancer and has been for nearly 2 years. So prior to your diagnosis, did you know much about ovarian cancer?
I knew nothing of ovarian cancer, absolutely nothing. I was just one of those girls who was, married and I had my whole life ahead of me, and I didn't think of anything to do with my body as being, something that could, I guess, be held to ransom by a disease. Like, I always thought I was really healthy.
So Gary, what's been the impact on you as a male?
This impacts on everyone around us. So it's not just Tanya, who's my wife. It's my mother. It's to people out there. It's their girlfriends, their sisters. It impacts on everybody, and that's something that I would not have known 2 years ago at all.
Pap smears don't detect ovarian cancer. They detect cervical cancer. That's a myth that must be dispelled. For however long I'm on this earth for, I will enjoy every single day that I possibly can.
Patients who are diagnosed with advanced stage disease, where the cancer has spread beyond the ovary, only survive about 30% of the time for 5 years. If you diagnose the disease in stage 1, where it's confined to the ovary, then you have an opportunity to surgically cure the patient, and that will translate to about a 90% cure rate.
You don't need to be a scientist to change this statistic. Help support this vital research. Donate today on 1300 Ovarian or online at ocrf.com.au.